Welcome to Ageless Island, where we talk about staying strong, sharp, and ageless inside and out. Today, we're going to talk about stopping Prolia and why it can backfire, specifically the rebound effect. So, for me, this is really personal. It started with conversations with my mom. She started having thigh pain and some other odd bone pain, and it got me immediately concerned because I heard that there could be some rare and serious side effects with Prolia. It's also called Denosumab, such as an atypical femur fracture. So that's basically your upper thigh bone, and it could just break for no reason. And with that pain she was having, it got me really worried. Plus, she had been on it for over 10 years. When she was put on it, there weren't long term studies, but now they don't recommend you stay on it that long. So I wanted to look at how we could get her off. So it started a whirlwind of research, labs, unfortunately, from my mom. And then we had to make some decisions. What could we do? So I learned more about bone loss and what happens when you stop Prolia than I ever expected to learn. So today I'm going to share what I wish more people knew. So I want people to know about the rebound risk. There's some labs that doctors don't always order, and just some smart off ramps and multiple therapies that can use to help you get off Prolia if you decide you don't want to be on it anymore. But again, before we go any further, I'm not a doctor. I'm just someone who's passionate about researching, who reads studies for fun, and occasionally gets overexcited about bone markers. So everything that I share here on Ageless Island is for education and for curiosity. It's not medical advice. Always check with your doctor. Prolia, back to Prolia. It's a strong, powerful medication, and it works by blocking a protein called rankle. So what rankle does is it shuts down your osteoclast, and what those are those are the cells that break down your bone. So just a little thing on how bone building works. So you have your bones, and these osteoclasts come in, and they eat away bad bone. So these osteoclasts come in, and they take that bad part out. So that's good. And then your osteoblasts come in, and they lay down good bone over top. So it replaces the bone that was just lost. And when you're young, when you have estrogen and everything's in balance, that works really well. And they stay in sync with each other. And then your bones don't get too brittle. So what this does, what Prolia does, it wants to keep the bone breakdown from happening too fast, which is a problem when you don't have the estrogen. But the problem with that is it doesn't rebuild your bones. It just keeps layering layer after layer of new bone on top of potentially bad bone. So it gives you better bone density, but not necessarily a good bone quality. Unlike some of the older bone meds that were out there like Fosamax, Boniva, or Reclast, Prolia doesn't stay in your bones very long. So here's the problem. When you stop it, the effect will disappear within months really fast. So unless you have a backup plan, your bones can start breaking down even faster than they ever did before you started taking the medications. So you could be in for this really bad rebound bone loss effect, and it can last up to 14 months. So those first 14 months are really, really critical. You have to do something when you come off Prolia. The rebound typically peaks at about 6 months post your last dose. And at this time, you also have a potential for hypercalcemia or a bone pain during the rebound as well. So the main takeaway I want everybody to get from this episode is if you are on Prolia and you stop, please don't stop cold turkey. Do something, have a plan, give your bones something to prevent these osteoclasts from going crazy. So that's why the rebound happens. So think of it like this. The Prolia puts these bone breakdown cells or your osteoclast to sleep, but they're not gone. They are just dormant and they're waiting to be reactivated. So when you stop the drug, those cells all wake up at the same time, like a swarm of termites ready to eat, like they haven't eaten in a year. So this leads to these skyrocketing bone resorption numbers. Your body at this point is breaking down bone way faster than it can build bone. It just can't keep up at this point for most women. In some women, it can lead to something called a spontaneous spine fracture. So this can happen without even having trauma to the spine. So it's very scary and something you definitely want to avoid. And it's one of the biggest risks of stopping Prolia without having a good backup plan. So that rebound risk, it also tends to rise the longer you've been on Prolia. So for my mom being on 10 years, she was at a really big risk for having a rebound effect when she came off. Anytime over 3 years, they say puts you at a bigger risk. People that have been on it shorter term may have milder effects and may not have as big of a rebound as somebody who's been on it over 3 years. But it depends on things like your age, if you've had previous fractures, and what your baseline bone density was. They all can play a role in how this is affected. But there's good news, and it's really empowering. There is a simple test to measure what's happening beneath the surface, especially if you're coming off Prolia. This test is called the CTX. It's short for the C-terminal telepeptide test, and it measures how quickly your bones are breaking down. So this could be really helpful when you're switching meds or you just want to know what's happening, even if you have osteopenia, osteoporosis between your DEXA scans. It's an extra tool that's really helpful that very few people take advantage of. There is a catch. A lot of doctors don't order it or won't order it, either because they're unfamiliar with it or they've heard that the results are not standardized. And in my opinion, that's really the patient's fault, because that is true. You need to get your CTX early in the morning. The first available lab test you can get, you need to try to schedule that, because the afternoon CTX values are not adequate for measuring. And also, you cannot have been on biotin for about 7 days prior to your test. So whenever you measure, be sure you get that test within an hour of your last reading, because it needs to be standardized in time. And again, always as early as you can get it in the morning. If for some reason you can't get your doctor to order the test, you can order it yourself. There are labs like Ulta Labs and Life Extension. And the great thing is, even if insurance doesn't pay for it, it's only about $100 a test. So well worth it, just so you know what's happening in your body. If you want even more assurance, there is something called a P1MP test, and it kind of does the opposite. It measures how much bone you're making. This one is more expensive and prices vary on this particular test, but another tool available. Once we decided to stop my mom on Prolia, we knew we couldn't just let this medication wear off on its own. We did not want this rebound effect to happen. So based on the research I did, reading studies, watching videos, reading reports, and this is a really good tool I recommend to everybody. It is a book called Great Bones by R. Keith McCormick. He is a chiropractor, and it is full of great information on osteoporosis, osteopenia, how it happens, what you could do to prevent it, all the different medications out there, their pros and cons, all the different supplements, pros and cons, what you could eat. It's just so much good information. But if you want a Cliff Notes version, he also has a YouTube video. It's called What You Need to Know About Osteoporosis Medications with Dr. R. Keith McCormick. I will link that down below in my show notes. And again, something really, really valuable and good to watch. So we decided, based on all this information, on Reclast, also called zoledronic acid. It is a once yearly IV medication in the bisphosphonate family. But unlike Prolia, Reclast binds directly to the bone and stays active for months to years. So that means it can catch that rebound effect before it gets out of control. That's what we were hoping for. So think of this as installing a safety net before the trampoline springs back too hard. And if you time it right, which is typically within about 6 to 8 months of coming off your last Prolia shot, the Reclast can absorb the shock and calm the bone breakdown surge. We used my mom's CTX scores to determine when the Prolia seemed to stop having an effect in her bones. So this is really important. So if you get it too soon while your CTX scores are close to 300 or below 300, that means the Prolia is still active in your system and the Reclast won't have an effect. So it's really important. You want to wait till the Prolia is pretty much worn off, and then you hit it with that IV of Reclast, and that's going to be when it's going to have its most dramatic impact on your rebound. Some pros with Reclast: it's long lasting. You only need the shot once a year, and it can help prevent the rebound if you time it correctly. Some cons is some people get kind of a flu-like achy feeling right after the IV. Luckily, my mom did not have that, so it doesn't happen with everybody. This too does not rebuild your bones. It just slows the breakdown. But for us, with her CTX scores already climbing, Reclast was the right move to avoid dangerous fracture window. So when we tested my mom's CTX level at 6-month point after her last dose of Prolia, it was already at 470 parts per milliliter. So that was a little scary because it was already a little bit higher than what we wanted it to be. But on the good side, we knew she was ready for the Reclast. So we got her in to an IV clinic, and she got that first dose of the Reclast. Then after switching her to Reclast, we retested her in November, and good news was her score dropped to 307. So that's right in the window of where we want her scores to be. So that gave us hope that the rebound had been avoided. But then 4 months later, her CTX dropped back up to 456. So we thought, okay, this isn't enough, but I really did not want to get her on a second dose of the Reclast that soon. So we wanted to try some other things to try to get that number down. I'd been wanting to put her on estrogen for some time because, like I said earlier, estrogen is the only thing out there that really builds bones the way nature intended. That's why we typically don't have osteoporosis, osteopenia issues prior to menopause. So it breaks down the bones the way they're supposed to be. It rebuilds the bones. And I really thought it was an important option for moms. So we talked to her doctor. He was a little concerned because she had not been on it for a number of years. And when she was on it, she was on Premarin, which did not really do well for her. She'd never been on bioidenticals, but we talked about it and decided the pros definitely way outweighed the cons. And she started 0.5 milligrams. And it's important to remember estrogen is incredibly bone protective, especially in women in or past menopause. It can lower those CTX scores and reduce your bone resorption. It can preserve your bone density. And according to studies, it can reduce bone loss by 30 to 50% for women in menopause. It can improve your sleep, your mood, and even help your metabolism. We also added a micronized progesterone. And again, the type of progesterone, micronized compounded pharmacy, really important to support sleep and protect your uterus. If you missed out on my podcast on hormone replacement therapy, I will link that below. Gives you a lot of good information about HRT and some of the newer research, and break some of the myths from, what people have heard about HRT in the past. It's not a replacement for absorptive medication. Sometimes, if your bones are really bad, you may have to kickstart your bones into gear again with some type of bone medication. So I'm not saying bone medication is bad. Some people do really need it. But if you are trying to come off some of the bone medication, HRT is a good place to add additional protection. Or if you're perimenopausal, it could be a good thing to get your hormones balanced so that you can preserve the bones before you start to lose them. Something else really cool, something I learned about, were vibration devices that you stand on. So there's low intensity vibration and high intensity vibration. And based on my mom's condition of having already pretty severe osteoporosis, we decided to go with low intensity because it's a safer route than the high intensity. If you are in osteopenia or very early phases of osteoporosis, maybe look at the high intensity. Again, I will link these in my show notes because there's a couple different kinds out there that are very interesting with some good study information on them. The one we went with is called the Meradigm Live platform. It is scientifically validated. It gives you gentle vibrations to stimulate bone formation. It's safe for older adults. In fact, the FDA cleared it for the US as a low-risk exerciser. It's been backed by studies showing improved bone density and balance for older adults. So it's a low vibration at 0.4 Gs. It stimulates those osteoblasts, or those cells that will build bones. So this is something that's actually going to get them to say, hey, build bones, build back up. And it just takes like 10 minutes a day to make a huge difference. You don't have to do it for half an hour at a time. Just a little bit of time, get on the device, let it shake you. Kind of reminds me of the old exercise belts in the past, but these actually have some proven science behind them. Another thing we focused on was supplements. So she wasn't taking hardly anything. I think all she was taking was baby aspirin and calcium, because on the Prolia, it does suck calcium out of your body. So they put you on calcium when you're taking it. So we added magnesium glycinate because it moves the calcium into your bones and activates vitamin D. We added vitamin K2. This particular type of vitamin K is very important because it will direct calcium into your bones, into your teeth, and not into your arteries where the calcium could harden and restrict the artery function. We also added vitamin D3, which I think is one of the most important supplements for anybody because a lot of people out there are low on D3. And in this case, it helps with absorption of the calcium. We added collagen because that gives matrix support to the bones and can make bones denser. And after years of not having the proper breakdown of the bone, I thought that matrix support was important for her. We added vitamin C because it supports the collagen and also bone building. And we added NAC or NAC because it can actually, in studies, it's been shown to decrease bone breakdown. And you guys know how much I love NAC. Again, in case you missed it, I have a podcast on NAG, great supplement for keeping your immune system in shape and breaking down mucus. So if you're prone to chest colds, check that podcast out. And again, it's also good for your bones. So it's a great supplement. And also, don't forget diet. Diet's important. A lot of leafy greens can provide these vitamins and minerals as well. So they don't replace bone meds. So again, if your doctor tells you you need bone meds, research them, make sure you get on the right one for you. I would suggest not getting on Prolia, except as a last resort, but that's my opinion only. I think it's scary because it's so hard to get off of it, and you can get off of the other ones. Different meds have their purposes and their times. But remember, these supplements can support your foundation and hopefully put you in a place where you don't have to get on bone medications in the first place. Then something else equally powerful is weighted exercise. So if your doctor says that you're allowed to exercise, it can be really impactful. So there's several studies, including a 2023 meta-study on Osteoporosis International that shows progressive resistance and weight-bearing exercise can increase bone mineral density in your spine and hips. And that's important because that's the area most at risk when you come off Prolia. This is fascinating. So the load does matter. As women, we've been pretty much told that you should do low weight at lots of reps because you don't want to build muscles like a man. And in reality, it's really, really hard for women to build muscle and look like a man. And especially as we get older, because we have less protein, less ability to absorb protein, and it's just harder to maintain muscle mass. So what's really important is putting stress on the muscle so the muscle can stress the bone and say, hey, build some more bone for us. So there are things like weighted vest you can wear during walks. For me, I wear a 10-pounder. If you, are just getting started, you might want to start at something like a 5-pound vest just to add a little bit more impact to those bones. And resistance bands, you can also start because that gives you gentle but consistent loading. There's a cool study out there called the Lift More study. I would recommend reading through it. It's pretty interesting information for postmenopausal women. It showed these postmenopausal women with low bone density, they performed high intensity resistance training twice a week doing these specific exercises. They did the deadlifts, they did overhead presses, and they did squats at about 80% of their max effort. And then after 8 months, the results were remarkable. In their spine and their hip bone density, they went up about 3% in each. Their posture and their confidence both improved, and they got stronger. And despite heavy lifting, no serious injuries occurred. And they believe this was because the training was safe, it was gradual, and it was supervised. So the key takeaway here is if you haven't done these types of exercises in the gym or in your home, get a trainer just for a couple of weeks to show you the proper posture, work with you on what weight you should be starting at and what weight you should go to, because it's so important that you do it in the right way so you don't put strain on your back or strain on your hips or your muscles in the wrong way. So, a trainer for a little bit of time can be really effective. The whole message here is that our bones aren't fragile. They need to be stimulated. They're waiting to be used. When we challenge them and are mindful of the resistance, we can challenge them and remind them they need to grow, they need to rebuild, and they need to stay resilient. One thing to keep in mind, at least for my mom, is CTX monitoring isn't over. So even though things are improving and we're on the right track, we need to keep looking at her scores. So she's going to be testing about every 3 to 6 months. So for us, that's probably the 4-month point. We're going to have her check her numbers again. This is the only way we can really know if her bones are staying strong or if something's starting to slip again in between her DEXA scans. So good news is her latest scores were 333, so down from that last score of 456. So it's not perfect, but it's going in the right direction. So we're able to give her that bone holiday. And I think that's really important as long as we can keep her off bone medication and keep her bones from breaking down too fast, we're getting some good quality bone built for her. So the CTX score is giving us good real-time insight, guiding our future decisions, like when we need to repeat Reclast or maybe put on something less strong like a Fosamax, or just the hormone levels or tweak the supplements. Remember, this is my family's story. Always consult your doctor. If you're considering changing treatments or adding supplements or switching from something like Prolia to a Reclast, please talk to your doctor because they know what's going on in your body and with your past health requirements. They know your full picture. I'm just here to help you ask better questions and know what could potentially happen if you stop or start some of these medications. So, if you're on Prolia and you're thinking about stopping, again, some reminders. The most important thing, please don't just stop. Have a plan, know what you can do to help prevent that rebound effect, and track your numbers. You deserve more than a one size fits all answer to your bone health. It's a personal thing. And the great thing is it's dynamic, it's trackable. You just need to know what your choices are. So I hope you'll tune into my next episode. I'm going to be talking about magnesium. There's so many different types out there. And I know it's important. I've heard, for years now, it's one of the most important supplements you can take, but it's like, which one? We're going to be talking about why magnesium is important and how it's not all created equal and what the different types do and why you might want to be on two different kinds. I'd like to thank you all for watching. It's nice to have you all here with me. Be sure to subscribe. And until next time, stay strong, sharp, and ageless. Thank you.